Benzodiazepines, or benzos as they are sometimes called, is a prescription drug class commonly used for anxiety. Benzodiazepines are controlled substances and are regulated by the Drug Enforcement Administration, or DEA, and Food and Drug Administration, or FDA. Common brand names of prescription benzodiazepines are Xanax, Valium, Ativan, Klonopin, and Restoril. Their generic names are alprazolam, diazepam, lorazepam, clonazepam, and temazepam. Current trends on those who use and misuse benzodiazepines in high school-aged individuals include the following. The left-hand side includes those who use benzodiazepines or prescribe the medication, compared to those on the right who misuse the medication. There is no difference in misuse between males and females, and highest misuse is among whites and Hispanics. One misconception around benzodiazepine use is that they are inherently safe because they are prescribed by doctors. However, these medications are prescribed for specific patients with medical conditions. The patients are educated on how to use the medication safely, and therefore it is not safe for individuals without a prescription to use this medication. Individuals are commonly prescribed medications in this drug class. A real-life prescription from a physician for a legitimate medical purpose and using the medication as prescribed is not abuse or misuse. However, abuse occurs when individuals visit multiple physicians for the same medication or intentionally use the medication incorrectly. Students may have access to this medication from friends or relatives that are prescribed the medication and sell it to the individual or give it to them. Lastly, students may be purchasing the medication from a drug dealer or some other stranger. Students may face certain risk factors that put them at a higher risk for abusing benzodiazepines. As example, students with poor coping skills or those immersed in a stressful environment, such as school, work, or their overall home life. Of course, there are also other risks, such as peer pressure, and a student may think everyone else is doing it. It is also important to note the greater risk of abuse when benzodiazepines are combined with other drugs, such as alcohol. Students may not be aware of this dangerous combination, or they may underestimate its severity. Either way, these combinations put students at a higher risk for worse outcomes. You may notice some signs or symptoms of benzodiazepine abuse in your students. Some of these may include weakness, blurred vision, drowsiness, poor judgment, poor thinking, lack of motor coordination, mood changes, or risk-taking behaviors such as driving after misusing benzodiazepines. The social impact behind benzodiazepine abuse can be profound. If more students abuse benzodiazepines, there is a greater pressure for other students to do the same. Benzodiazepine abuse may also limit the development of coping mechanisms for stressful situations, setting up the students for other struggles later in life. The most important social impact from student benzodiazepine abuse is the risk for future substance abuse problems. Abusing benzodiazepines puts the student at a higher risk for substance abuse problems in the future. More than 90% of adults with a substance problem begin using drugs, smoking, or drinking before the age of 18.